What do you think, guys? Do you think I'm live right now on the Facebook? I don't think so, right? Okay. Here, group should be the one. That should be the group. Post and go live. No. Go live. The next streaming software or live tips. Share group. Fine. Streaming. I don't want streaming. Just go to webcam. And then start screen share. Which one of these? Wow. Okay. Just window. I believe it should be this one. Just share. Okay. All right. The main course. Alpha. Exam discussion. Sorry, guys. It just may take a bit of time. I'm trying to, thanks. I'm trying to fix this. Wow, and the quiz will finish already in... let me do something with the quiz because there's a time. Choose this one. Guys, I think, guys, we need to finish this quiz in exactly, I would say 1 hour and a half, maybe. Okay. Next. Yes. So this one should drop. This Facebook. Let me just put this one down. This one down. This one down. This one down. Keep this one on. Okay, guys. Can we now, guys, check if I'm online the Facebook or not? I actually hope so. Let me just say, go home. Stop this. I don't want to see it. Let me double check, guys. So please, guys, if I'm actually on the Facebook Live, please let me know. Sorry, guys, technology sometimes can sometimes give us some issue. Okay. Export. Hey guys, we just only go and start right now. Just guys, give me one second, please. Okay, guys, let me check right now if I can see your comments or not. No, there's no comments here. Let me check here. It's not here as well. That's very weird. I can see your comments. Anyway, I may use my phone to see the comments at least for now. But there's a page, right? Yeah, there's a page. Hmm. No, don't leave page. Cancel. Anyway, guys, so there are lots of things happening right now. By the way, before we start this mock discussion, how was the mock, guys? And before I start, I would love to check in every one of you. I may use my phone to see really if, because yeah, I have seen before that we are on Facebook Live. But I cannot see it here on my. Seems like I'm not anymore. It dropped again. That's very weird today. Why? Okay, guys, let's start right now. So yes, I can see on my phone that we are live on Facebook, but not on the other. So guys, I will start right now, okay? Okay. So I check Dr. Yeah, I can see now Dr. Liv, but not here in my screen. When I check here, I don't know why this one is open. Let's say here. Even it doesn't give me that let me refresh with refreshments. Not even that's okay. Here. Now I can see something now. Well, it's very good. Finally, I can see the screen here, right? Okay, guys. That's great news then I can see. Very good. Okay, guys, before I start, I would love checking every one of you guys. I see Dr. Apova and Dr. Liv. Hi, Dr. Liv, how are you going? Dr. Indra, how are you going? Dr. Fatima, Dr. Taslim, Dr. Melzma, Dr. Apova, Dr. Indra again, Dr. Sangeeta, Dr. Natalie, and every one of you guys. Thanks very much. Okay. So my question, guys, about the mock, and then I see Dr. Amolia mentioned mock was good, but it wasn't good enough. Why it wasn't good enough? What did you do in it? How much did you score? Look, I have seen people scored above 90, so it means like you can score above 90, right? Thank you, Dr. Tasnim. I'm doing very good. Thanks very much. Okay. Mock was good, Dr. Melzema. Mock was tricky, Dr. Lev, a little bit, not very much. A great mock, by the way. Dr. Kushikan, Dr. Fatima, mock was good, doctor. Good, Dr. Bidu, how are you? I'm very good. Okay. So, guys, would you like? I have decided, I planned to do a mock. It's gonna be a little bit tricky. Not tricky, it's just very tricky. And this only for 50 candidates, and I post for it. And actually, 10 of these candidates, the candidate they scored 10%. Sorry, the 10 candidate they scored above 90%. The 10 candidates they scored the highest in the last mock, they will be already in the next mock, plus another 40 candidates. Right? So only 40 candidates plus the 10 highest candidates scored in the last mock will be in the next mock. I already guys posted for it on my group or our group. So please can check this. Okay. By the way, guys, I already have done some Bidu math for every one of you. And yes, I'm working more things because exam getting sooner. So that's why I'm doing more things, guys, is even the course itself. I'm updating lots of stuff in the course itself. No problem, Dr. Lev, you will know right now. All questions seems to be no, but went wrong. What, Dr. Fatima? Okay, Dr. Manisha, Dr. Bidu, mock was good. Need to improve more. Full of tears. Why? Don't say this. You're always doing good. Okay, by the way, guys, I would love to congratulate the 10 champions. They scored above 85. I have seen this, or above 84, right? I can, you know what, the names already. Let me just give you the names because I'm really, really very proud of them. They really did very good. Okay, I tell you the names right now. And by the way, guys, did you like my Bidu math? Should I do more Bidu math? I give you 40 Bidu math, and then this 40 Bidu math, believe me, everyone can be a question exam. Okay. If you're happy with that, I can actually do more. This is, okay. So from the list here right now, I can see Dr. Treza, Dr. Kelvenda, Dr. Sonia, Dr. Anuradi, Dr. Daniel, Dr. Shiva, Dr. Melzma, Dr. Leyu, Dr. Poonam, Dr. Dania. I'm very proud of you. Definitely, I'm very proud of everyone here. But really, with your results, that shows that you have outstanding dedication and something special than anyone else. And that's why I'm very proud of you. Guys, they scored 92% until 84%. 92%, 88%, and 84%. All of them from the top to the bottom. Okay, now let's start. Guys, can you see the screen? Can you see the questions right now? Let me check. I think I need stop. I'm afraid, no, don't do anything. Thank you, Dr. Melzam. I'm very proud of you. Guys, can you see the questions here? So the first question saying, given the X-ray below, what is the root development status on the tooth number 21? What do you think, guys? That's tooth number 21. What is the status? Is it healthy developed? The answer is no. How did I know it's not healthy developed? Because if you check here right now, you'll find the root shorter than the adjacent root. Let me just get some drawings. Ta, 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 ta. Okay. Give me guys 1 second because even I cannot see. That's very weird. Imagine I cannot see. Whereabout is annotation? Where is it to annotate? Now something going on with Zoom, I believe. The problem is Zoom. Because even I have no option for to annotate. Gosh. Participant chat, react share, hostels, more, records. There is nothing. Wow, that's very weird. Anyway, guys, sorry guys, I cannot write down or highlight. So I'll explain every option individually because I don't have the option now here. I don't know why. Anyway, the first one, which is healthy developed, that's not true because actually the root of the affected tooth is shorter than the adjacent tooth. That's why it's not healthy developed. And then just developed, this is the language for timing. Just developed mean it just have developed recently, lately, maybe in a day or so. And this definitely not. It's actually has developed long time ago. Root resorption, I cannot see any root resorption on any part of it. Immature apex, that's wrong because apex is mature because it's not opened anywhere, right? So the right answer is almost developed, means it's too close to be sound, but not sound. So the answer, guys, be bravo. Next question. Hmm. Okay, guys, what think guys answer next question? Let me check your answers. No screen zoom. Ah, wow. No, I don't think really you can see on Zoom. Because what has happened is when I share the screen, I shared it from Google, not from screen. See, Charlie, I can see, guys, the answer now is C, Charlie. Please, guys, will find on Zoom, maybe it's not working. And then I know some of you rely on Zoom because they have Facebook. But guys, sorry, guys, it's just a situation right now. Okay, so which one the right answer? C, Charlie, the right answer. We need to do for this tooth internal bleaching using 2 grams of sodium perborate with water. This is effective and still safe as well. So this is the most safest and still effective. Home whitening using carbamide peroxide will not work because actually we need internal bleaching, not external. Home whitening is external. Internal bleaching using 35% hydrogen peroxide is perfect. We love these options, but it's not the safest. So not right. C is safest and still effective. Antenna bleaching using 1 gram sodium piperate with 10% hydrogen peroxide. I don't think this is really will be enough because we really need to mix it with water. Antenna bleaching using carbon peroxide with it application, again, that's not safe. So the best is C. You have chosen the most appropriate bleaching material for antenna whitening of the treated tooth. What is the most appropriate management of this bleaching material? Guys, what think guys the answer now for B? Sorry, for question 3. B bravo. Review and replace material every, yes, I would say so. That should be the best. Please guys, everyone Zoom. Please guys, everyone Zoom. You know what I can do? I tell you something. What I can do is I can share on Zoom because I know some of you rely mainly on Zoom. What I can do is I think I can share this. I don't know exactly what we'll see, but we'll see what exactly I see maybe. Okay. Maybe now guys on Zoom you can see what I see exactly as well, okay? Because I know some of you don't have Facebook and only work on Zoom. So guys, answer this case is actually B bravo, as you see right now. Why? Because when we review, we can actually check what's going on, and it's better actually. Okay? It's better actually to see what's going on than to keep the patient his own for more than 30 days or 28 days. It's better to get the patient the clinic every like once a week and they check what's happening. Otherwise, if something going on in this case, you may not be able to manage it. And this is one of the things really we prefer to be review and replaced every 5 to 7 days. You will find this information, Dr. Paul Abbott book. You will find this information. It does mention ADA guidelines in ADA 2 things. I mentioned that most of the dentists, they actually do this, but some laboratory approaches say you can leave it for 28 days. So it goes clinically based rather than the laboratory approach. So answers B, bravo. And definitely it does make sense. And the next question, it shows you how it does make sense. Okay, guys, question 4. What do you think the answer for question 4? Let me check the answer right now. Also, I will get Zoom from my side to see what you see, guys, on Zoom. Okay. Yeah, it seems like in Zoom that was a little bit acceptable. Like it's fine now in Zoom. That's okay. Okay, guys, the answer here right now, if I check your answers, I'll see B bravo, right? Dr. Melzman mentioned after place leave. Yes, we leave it for 28 days, yes. 7 days, then replace. 2 for weeks. Yes, I agree in this one. Color is acceptable. I love this answer, Doctor. Is this from ADA article, Dr. Melzman? Or from Dr. Paul Abbott? Which one is this, Dr. Melzman? Yes, that's true, Dr. Melzman. After place, leave 5-7 days. then replace every 2 4 weeks. Once care is acceptable, removal is way to yes, I would say it's fine then. Yeah, it can be Dr. Gagandi, but it not will not be that much effective as internal bleaching. You may do it just intentionally in the sorry, initially in the beginning and then double check after this. But will not be that much effective, by the way. Okay, guys, so the answer here, it should be Bravo. You must do scale first and then clean and polish and then extend the bleaching for all the teeth. Why? Because it's easy. The trick here is we need to know. Look, next question actually will give you the answer of this question. Because when you do external whitening in the clinic, what happens, we'll find all the teeth nicely white except only that tooth. And then after this, the result will be based on the rest of the teeth. Because you cannot make the tooth whiter this way. Because if you start with internal bleaching first, you will find that this tooth is whiter than the rest, and then the patient will not have the color. That's why you need to make all the teeth white, except this one. It should be with the same color, and then start to whiten this tooth based on the group. So it's easy to manage the color of one tooth rather than the rest of the teeth. Okay, so now this tooth color should follow the rest of the teeth color, but not the way around. You cannot control to make all these teeth same color like this when it's very white. That's why it's better to do scale and clean. Then you whiten all the teeth except even you can even put a little bit of external whitening here, right? And then you get the desired result, the one you want or the one you can for all the teeth. All the teeth looks very nice and white. Then you can do this tooth after this. But to do this tooth first, what gonna happen is it's gonna be whiter than the rest, and then to make all the teeth same color like this will be very hard. So the answer is B, Bravo. We do external to whiten all the teeth. It will be our references for the color, and then we whiten that tooth based on the rest of the teeth, but not the way around. So the answer, guys, B, Bravo. Next question. As reading dentist, what is your overall clinical judgment of that, guys? You see, clinical judgment, guys, always clinical judgment. Are you happy, guys, with this result or not? And then our champions actually was asking, yes, I can be happy. I said, guys, don't think as a dentist, think as a patient. If I ask you to go home with this teeth, you will be happy with these colors then. You will happy with this dark color, this dark color, this dark color. You happy with this thing, you happy this whiter than the rest. Wow, are you really going to happy with this? A patient comes because you want to see all that is white to end up giving him 15 color shades. Definitely we're not happy, right? Thank you, Dr. Gagandi. Very good. So the answer is the result is unacceptable. Further consideration should have been done. What was a further consideration? The first consideration which should have been done is you whiten all the teeth first to get the proper whitening shade. Then, based on the shades you're gonna get for the rest of the teeth, you now plan to whiten that tooth to be similar. Let's say even if you cannot, just whitening doesn't work, you can use veneer in this case to get the same whitening. But you cannot make this tooth whiter than the rest, and that's why you cannot leave the material there for 28 days. It's better to check. Every 1 week to check the progress. Once you see the desired shade, stop. So now the answer is D delta. Next. Next scenario, please, guys. Based on the clinical information and dental radiograph provided, what is the most likely range of this patient? Age range of this patient. Is it 4 to 5 year old? Is it 5, 6 year old? What do you think? Let's see the different answers right now. Okay, guys, if your answer actually is D delta, means like you really did great job, guys. And that's why it's called 98 or 84. Okay. So you're right, guys. The right answer actually is D delta. 8 to 9 year old. Why is this? Why 8 to 9 year old? Because when you look at the occlusal plane right now, you will find that the tooth is already erupted, lower six and upper six, both of them, they nicely erupted and the same occlusal plane, and you can see somehow the curve going up, right? Means this patient or this child is about 8 to 9 year old. What about 4 to 5 year old? 6 will not be existing. 5, 6 year old, 6 will be at this level. Here, just here, going to erupt. 6 to 7 means it's erupted but not in occlusion, somewhere in here. 8 to 9 means it erupted and nice in occlusion. 12, 13 year old, you cannot see this, you shouldn't see this deciduous teeth there at this age. Or at least you don't see the roots out of them. So the answer here is 8 to 9 year old. Next. Based on the attached X-ray, what is guys the answer for this question then? The tooth is most likely causing the pain. Guys, that's the way you need to think in exam, by the way. These questions, it just does cause the same question you may get in exam. Let me check, guys, your answers. 7.5, I see most of your answer, guys, 7.5, which is D delta. Let me tell you good news. You're totally right. It's 7.5. The right answer, 75, D delta. Why D delta? Which is 75, because if you look at you may get confused about the tooth number 74 because it has a big curves as well. But let me tell you, there's big curves. It does show that there is a reducency on the furcation area. And if there is reducency in the furcation area, means there is infection happening there. It can be either acute infection, and in this pain, it can be severe. As it's mentioned in the scenario, the pain is severe. But when you read the scenario very closely and with focus, you will find out that The tooth is not tender. Somewhere here, you can see this. What does it mean? It means it's a chronic infection, not acute infection. So it shouldn't be that much. You see, tenderness to percussion was generally negative, not very tender. It means the abscess doesn't give the pain. The pain should be another tooth, which is this tooth, right? Guys, this type of concept is very important for the exam. And that's why I would say the tooth number 75 is the tooth that's causing pain because definitely it's just a nerve down there. It could be irreversible bites and the patient could sleep. Question 3. So guys, what do you think the answer to question 3 then? Let me check your answer. C, Charlie? Okay. Based on the clinical findings, what appropriate treatment for tooth number 74? Perfect, guys. You're doing really great job. See, Charlie, extraction. Why? We mentioned it. There is a periapical, there is infection in the furcation area. Definitely do extraction, right? Very good. Next. The child is anxious and treatment must be done today. What is the most effective way to manage this child behavior? D and A, C, no, D, D, A, Dotumelzima A alpha. Ah, that could be Dr. Melzma. Why you got 92 or 84? Did you get a 94 or 2? Anyway, that could be the reason why, because this question was incorrect. DNA, I see DNA. Guys, please, you must choose the keyword. Please, guys, choose the option based on the keyword. The child is anxious and treatment must be done today. What is the most effective way to manage this child behavior? The most effective. The most effective. Do you think A is the most effective, or B is the most effective, or C, or D, or E? Which one is the most effective? The question asks about most effective, guys. Forget if it's a mild or severe or whatever it is. We just ask about something, you just do it and get peace of mind. You're just gonna get peace of mind when you do it. You don't care about, you will not, you will not think about it anymore. Right, guys? From these options right now, the most effective out of these is what you can do as a dentist as well, right? D delta is the most effective out of these options. Plus, you can do it as general dentist. Next question. What local anesthetic is the most appropriate in this case? He's a child. He doesn't have that much medical history. By the way, guys, I'm very proud of you because you scored high in this mock. However, it's very tricky mock as you see right now. People think this mock is easy. It's not easy. But the only thing made it easy is your study because your study this time you already focused on the 7 classes we give it to you on the Facebook, or actually the recording was on the Facebook. And I believe because he put effort, that's why I scored high. That's exactly gonna happen in EDC exam. ADC exam, this mock, everyone has passed the exam before told me the same thing. They told me the mock exam, even you can hear from them, right? You have heard this from them. They said the mock exam, the most important things. When you score high in the mock, you're gonna score high in ADC exam. And this is actually what we do. And I'm very proud of you this time. I wasn't happy the last times, but this time I'm very happy. So now, guys, the answer is easy for everyone, right? Right? A child, his medical history, there is nothing here to make it contraindicate with anything. So now A alpha is a gold standard. Next scenario. Based on the periodontal finding, what is the clinical attachment loss scale? There is 9 millimeter pocket depth plus 3 millimeter. So guys, scale equal to very good. I see your answer right now. C Charlie. So I'm very happy with C Charlie. 12 o'clock. 12 o'clock? 12 millimeter. What is 12 o'clock? Dr. Raza mentioned C Charlie 12 millimeter. Dr. Melzma, which is Dr. Okay, C Dr. Sabika. Dr. Sarah. See, I'm very happy, guys, with this. So answer, guys, is C Charlie 12 millimeter. Next question. Why? Because we add, when you have gingival recession and you have a pocket depth, you add both together. So attachment loss equal to pocket depth plus gingival recession. Easy concept. Consider the patient medical condition. What is the most appropriate local anesthetic for dental extraction in this case? There should be a medical history here. Patient on monoamine oxidase inhibitor. Because the patient on monoamine oxidase inhibitor will not prefer to give him adrenaline. Adrenaline is not a good thing, right? And the best alternative for adrenaline as vasoconstrictor is philipressine. So in this case, we're gonna choose prelucaine with philipressine. The answer is C, Charlie. The maxillary anterior radius flappy, as you see right now. What is the most appropriate impression material technique? Easy. We discussed all, guys. Did we guys discuss all this information, guys, in our class or not? Yes, no. Dr. Kanika, yes, see, very good. See, very good. I'm very proud of you, Dr. Kanika. See, Dr. Sangita, very good. Dr. Melzma, yes, we discussed, right? Dr. Sabika, see, I'm very proud of you guys. You see, Things is, you see, things are easy now. And believe me, guys, that's what you're gonna get in exam. Yes, we discussed them, right? This is what, like, imagine exam it just this way. If you're going to go through all these questions, all this information, when you go to exam, you'll be able to answer it right, and then you pass. Right? That's it. It's not hard. Exam is not hard. You just only need to know the right information, the right things. That's it. So answer, guys, as you said, C. Charlie, light body, polyvinyl silicon, custom selective pressure tray with a window technique and the green stick compound powder molding. Next question. A mandibular molar abutment is rotated. Which clasp is most appropriate? We always say the ring clasp is the king clasp. It's used actually for, we always say the king clasp is the ring clasp, or the ring clasp is the king clasp. What does it mean? It does, we need to have a crown as a sort of clasp on a rotated tooth. So when the tooth is rotated, use ring clasp, because ring clasp will be like a king clasp for this case, like a crown. Okay, so guys, now the answer is C. Charlie, ring clasp. What is the most appropriate mandibular major connector considering the lower and two teeth have grade 1 mobility? We said this, and required duct retention. There is one major connector indicated when there is a mobility of the teeth, plus it can help in indirect retention. What is, guys? If your answer is E echo, which I believe most of you has provided this as a C right now, Dr. Hash E echo, Dr. Raza E echo, Dr. Kainet E echo, Dr. Maya. Yes, metal on a tooth, because this is a definition for indirect retention. As we explained the class, hard component rested on hard structure will work as indirect retainer. So the best way is lingua plate, because it's hard, right? So guys, E echo, lingua plate. Now, based on your findings, what is the most appropriate periodontal stage, guys? Based on the findings. Before I give you similar question like this, and most of you answered wrong, I believe this time you should have a proper answer. And this is a benefit of the mock exams. Mock exam is actually an eye opener for every one of you. Very good. I'm very proud of you. Now, guys, you got it right. Before, you used to say, we cannot, doctor, we cannot decide on staging because there is no enough information about other things. We said the bone resorption level is enough to decide. You can. And if you have a bone resorption more than half of the roots, more than midway of the root or half the root, it means you already stage 4 through the way. That's why this case is actually, as you see right now, it is stage 4. Why? Because the X-ray shows the bone resorption more than half of the roots. Very good. I'm very proud of you. I'm very proud of you, Dr. Rochita. Yes, Dr. Shreya has explained it to you. Very good. Dr. Pooja, it should be the delta, not A. Very proud of you, Dr. Ra, Dr. Mendra, Dr. Hash, Dr. Oma. That's a great one. And then Dr. Sabika, very good. You see, guys, believe me, I gave you the same question in one of the last mocks and you answer it wrong. Now I'm happy and proud. You're getting more information. And that's exactly we need to get. So everyone attending classes, attending mocks, you will get the best help. And this help can help you to pass the exam. I'm very proud of you. Answer, guys, D delta. What is the most appropriate periodontal grade for this patient? This is very tricky question. Very tricky. Why? Because the patient previously stopped smoking. He used to smoke 10 cigarettes per day, but he stopped the 10 cigarettes. What do you think the right answer? It's a new concept. He just stopped. Right? I see some of you may get confused because it just he has stopped. And then you may think it's grade A. The answer, guys, is still grade C. Why? Because the effect of smoking, it will last for a long time. It will not stop. It will not stop in a few days. So this condition has happened in the long run. This condition has happened more than 2 months, 3 months to end up with this situation, right? So definitely smoking was the reason at the time that this condition has happened. So still, it's great C. What is the most appropriate look anesthetic, guys, in this case? You're going to extract the lower anterior, right? Let's say mandibular removal partial denture has, okay, severe liver. Ah, no, he has liver cirrhosis. You may extract 1 or 2 teeth, whatever in the teeth. Patient has liver cirrhosis. Guys, which is the method of choice here? We discussed this in the classes, remember? We said Artican works fine, if you remember. So that's why the answer is C, Charlie. Artican, 4% with adrenaline. Next question. The patient has a strong gag reflex and needs an impression for removal partial denture. What is the most appropriate impression material? We discussed this concept as well. See, Charlie, I'm very happy. Dr. Taslim, see Charlie, very happy. Dr. Melzima, see Charlie. Dr. Natali, see Charlie. Yep, Dr. Raza, you're right. Articane is meta, yes? See Charlie, Dr. Amolia. And Dr. N, see Charlie. Dr. Asha. Dr. Asha, see Charlie. I'm very happy with these answers. Yeah, primary. Dr. Lupus, see Charlie. Okay, seems like Dr. Asha. It's E echo, E echo. No, you see, there's a trick here. So I see two of you guys, Dr. Asha mentioned E echo. There was another option, E echo as well. I have seen it right now. Okay. Either way, primary, secondary, either way, Dr. Oka. The trick actually, guys, do you know, guys, where about the trick here? Fast-set alginate. Ash is very flowy. Very flowy, can easily flow in the patient's throat. And then the patient, and instead of taking the impression for the teeth, he will take the impression for the throat. And patient will be choked there and then will be coughing a lot. Do you know, guys? Thank you very much. The word impression material, the question asking about impression material. Thank you, Dr. Lev, Dr. Endra, Dr. Koshikan. Because the question asking about what? The question asks about what is the most appropriate. Look at this impression material. E-echo, not an impression material, it's a technique. The question, you see, guys, language. Please, guys, keywords. Look at the keywords in the question. Ask about the impression material. So that's why the answer should be polyvinyl siloxane. Not flowy as alginate. Alginate like water. The patient asks whether vaping is safer for his teeth than smoking. Which statement is most accurate? A alpha, I'm very happy. So the Suyash now even you can use articaine for also now, like based on the new data, even you can use articaine for nerve blocks with no issue at all. That's okay, Dr. Asha. You didn't think about this before, but next time you will think about it, okay? You're doing good. Dr. Omar B, because of dry mouth. You will know the right answer now, Dr. Omar. Dr. Gagandib A alpha, Dr. Rochita C Charlie, Dr. Kanika A alpha, Dr. Sharia A alpha. The answer, guys, is A alpha. That's true. May increase carriage risk, but evidence limited. B bravo, strong evidence proves vaping increase carriage risk. No, we don't have strong evidence. Yeah, we have found that vaping may increase the carriage risk, but still limited. We need to do more evidence. Okay? More study to get more evidence. So the answer, guys, A alpha may increase carriage risk, but evidence is limited. By the way, you will find this, guys, in TG, okay? Guys, how did you know, guys, about this information? Everyone answered A alpha. How did you know it? Yeah, because there is not enough study yet. Because it's something new, that just only study new. Dr. Ruchita, when someone have liver diseases, in this case, we like to use articaine because it will be metabolized mainly by the kidney and some enzymes, which is plasma enzymes in the cells, not in the liver. That's why we use it as a material. Can be used as infiltration, yes. Can be used in nerve block. Recently, it's mentioned, yes. Before, they used to say no. My lecture? Okay. That's very good then. I made mistake in it on mock, and I understood that was a wrong. That's okay, Dr. Lev. But we learn, right? I believe you have done mistakes before, as every one of us, and then we learn by time, and then we fix this. We all human. We do this. In vaping session, very good. Very good. By the way, guys, we'll find it in the ATG. The ATG will find this information there. You can even read it there. We still follow OTG, yes, so far, yes. Based on the clinical findings, what is the most likely diagnosis for tooth number 46? Very tricky question, guys. This one's very tricky question. Now, let me check your answer first. Wow. Wow, golden you guys. How did you know this? Wow, how did you know, guys, the answer D delta? Guys, do you know the answer before the mock or after the mock? After you answer the mock or before you answer the mock? Wow. I agree in this, Dr. Liv. Definitely, I agree on this. Wow, D delta. Most of you guys go with D delta. I thought really you're gonna get stuck in this question. Dr. Shashank says, I don't remember what I answered the mock. Pain severe with heat and relieved by cold or necrosis. But not just necrosis, it's infected necrosis. Yes, before. Very good. Very good. Good in you. Yes, guys, answers D delta. Infected necrotic pulp with acute apical periodontitis. Why this? Because when you look at the sign symptoms, you will find dull pain. When you have dull pain, right, from the tooth. And then means like is not really very severe type of pain, because if it's very severe, type of pain, you may go with the word symptomatic, irreversible. When it is very severe, it's just dull, not sharp. Normally sharp is irreversible bites, but it's not sharp. So now it's not sharp. So this one is gone so far. Explain the pain becomes severe with the heat only when there is heat. Okay, until this moment, you may think about late stage of irreversible bitis, but is relieved when applies cold. And the way around, irreversible bitis should have pain increasing with cold. So definitely that's not right too. So, and this is classical features for infected necrosis. So now, when you have infected necrotic pulp, the patients will complain from severe pain with hot that relieves when drained cold. So now we're looking for infected necrosis, not just only necrosis, because necrotic pulp has no symptoms. Necrotic pulp without infection has no symptoms. Okay? There are no other remarkable. Oh, yeah. And the tooth is tended to percussion. If it's tended to percussion means there is acute. Why not chronic? Because chronic will not be tender with percussion. Will be maybe a little bit discomfort, but not tender. So now I hope the answer now clear. I'm very proud of you guys. You got the right answer straight away. The junior dentist believed the working lens looks too short. On the radiograph, which explanation is the most appropriate? The junior dentist believes the working length looks too short on the radiograph. Which explanation is the most appropriate? Let me check your answer. It can be, guys, this one really, really going to be for you. It's going to be wow, like a big one. Some of you now will get surprised a lot from the right answer. I see the answer right now going to be Dr. Shashank A alpha, Dr. Slim A alpha, Dr. Mai A alpha, Dr. Gandib A alpha, Dr. Anna A alpha, Dr. Kanika A alpha, Dr. Koshikan A alpha, Dr. Liv A alpha, Dr. Vanik A alpha, Dr. Natalie A alpha, Dr. Hash A alpha, Dr. Amoli A alpha, Dr. Melzma. Oh, wow. Dr. Melzma, like, going the way around, guys. She nailed it. See Charlie, Dr. Harisha, see Charlie, Dr. Ashnit, A Alpha, Dr. Yetri, see Charlie, Dr. Sonia, Dr. I believe, you see, that's why Dr. Teresa, that's why it's code 92. That's why I'm the first person, all of the tens, right? Because you attend the session and write down what I said. Thank you very much, Dr. Teresa. You mentioned see Charlie. Thank you. I love this. Dr. Andra, see Charlie. Guys, everyone has mentioned A alpha. That is okay for now, but please pay attention because I have drawn this in one of the sessions. I told you, not necessary every time that the radiographic apex should be 0.5 or even 1 millimeter away from the apex on the radiograph. It's not. It can be on the radiograph, it can be under 3 millimeter. Why? Because it's two-dimension X-ray, not three-dimension. Maybe there's a curvature of the apex area, maybe there's some structure has actually superimposed on the roots. Maybe the apex actually is too high already, the apical construction. So that's why, guys, I'm very happy. Now you answer C, Charlie. A alpha C, Charlie. Okay, guys, Dr. Pooja, I have already done this one right now. Okay. Answer, guys, is C, Charlie. The working length can normally be between 0.3 millimeter short of the radiographic apex. Yes. Yes. That's totally true. By the way, guys, you can double check this in Australian Dental Journal and Dr. Paul Abu book as well. You can find this as a reference for you. Thank you for everyone has answered C Charlie, and that was good effort for the everyone has answered A Alpha. But I liked, and that's why you scored. You are the highest, Doctor, because you really remember what's been mentioned in the session, and maybe you revised good as well. What is the most appropriate next step to confirm the working length? I mentioned this in the session as well, if you remember. Repeat the radiograph using different vertical angulation. It does not make sense to use vertical angulation, but you can use horizontal angulation, maybe. If the short obturation, sorry, short working length, in this case, you can use slope technique in horizontal way, but not in vertical. To just see it from the other side, horizontal, not vertical. Okay, to find if there is any curvature anywhere. But the best is beach B, which is use apex licata. Apex licata is the best things to determine, right? Plus the X-ray together will be the best. Dr. Sarah, be bravo. Dr. Moaz, be bravo. Very good. Dr. Kainat, yes, we love Apex the best. When you ask the Indonesians, they rely on it very much. Thank you, Dr. Teresa. I'm very proud of you, Dr. Teresa, and everyone, guys. Very good. Be bravo. Next question. What is the most appropriate initial intracanal dressing for this tooth? In here, we look at the pain and infection. We look at two things. Pain and infection. There is pain. If there is pain, in this case, leather mix. If there is infection, in this case, calcium hydroxide. If there is pain and infection, I will start with leather mix. Then, after the pain settled down, the inflammation settled down, we apply after this calcium hydroxide. So the word initial means what are you going to do initially? As long as there is pain initially, stick to leather mix. That's it, not 50-50. As long as there is pain, don't use calcium hydroxide because calcium hydroxide will increase the pain. 50-50 if it is a symptomatic infection. A symptomatic infection. You can use 50-50. Or you can use leather mix and then calcium hydroxide at this case. No, guys, be bravo, not the right. Let me check. No. No, not C Charlie, please. Please, guys, answer A alpha. Let me check now. Dr. Omar A alpha, I'm very happy. Dr. Suyash A alpha, I'm very happy. Dr. Sapika. Why C, Dr. Sapika? Dr. Samandra A alpha, Fatima. A alpha, Dr. Indra. A alpha, Shashank. A alpha, Dr. Maya. A alpha, Melzima. A alpha. Good job in you, Dr. Melzima. That's why again you scored high. I'm very happy with this. No problem, Dr. Pooja at all. I did see why. We mentioned this many times. Please, guys, you need to focus. Then you see, there are some of you. I know you attended the session, but please, guys, you need to focus. Please, guys. I won't explain again, but guys, that's what I did last time, guys. Explain to you. Okay, Dr. Lakshmi, Dr. Gandeep. But the patient has pain still, right? It's still pain, whatever, but still pain. Still pain, however, but still pain, right? Okay, guys, now leather mix. Leather mix, it has two main things. It has corticosteroid, cortisone, and antibiotics. Cortisone, anti-inflammatory. So when there is inflammation, means pain, it does reduce the pain. Antibiotics, if there is infection, it does help in infection case as well. This leather mix. So we provide leather mix when there is pain, mainly when there is pain. As you see this case, Patient has pain. Look at this, dull pain. Okay? Yes, the pain became severe and relieved, but still it's dull pain. Okay, very good. Now, calcium hydroxide. Calcium hydroxide is very caustic, very caustic. What does it mean? pH is 13 pH. What does it mean? It means it does increase the pain. It's very irritant, very irritant. So as long as the patient has pain, means there is irritation happening down there. Especially your diagnosis was what? Apical periodontitis, itis, inflammation. So when you use calcium hydroxide inside, may the effect result in again severe pain. So you're gonna add more pain to the patient. Patient will not be able to sleep. Avoid it. You don't need it now. And then the key word is initial. So what things can reduce the initial pain? Definitely leather max. So can I put 50-50? No, because again, you have calcium hydroxide can increase the pain. So in the beginning, use leather max until the inflammation, the irritation, which is periodontitis, should be reduced first. And then once it reduces, and even leather max has antibiotic, it will help even if there is any infection inside. Right? And then once it happens, you can shift to calcium hydroxide after this. I hope now it's clear. Answer is leather mix. The key word is because there is pain down there, you cannot use calcium hydroxide. Otherwise, result in more pain, which is inflammation down there. You discuss with the patient the importance of placing a crown on tooth 4-6 after RCT. What should the provisional crown be placed? People say this is an easy exam, easy mock. How come this is an easy mock? Odontopay the same things, Dr. Ravi. Odontopay the same like leather mix. When there's a cases, maybe in kids, because tetracycline is in actually in leather mix. Odontopay doesn't have tetracycline. So if you are worried from staining of the teeth, use odontopay rather than leather mix, because leather mix has tetracycline as an antibiotics. A Alpha, Dr. Raza, B Bravo, Dr. Lev, Dr. Shashank, B Bravo, Dr. Eshikadi Delta. Please, guys, attend the session, please, guys, because these are all ADC concepts. Please, guys, attend the session. Answer is A Alpha. Please, guys. I have explained this in the session before. Do you remember the clinical case we explained it when the patient has a crack in the tooth after the second day after RCT? Remember, guys, this clinical case? Guys, it's a big dream. To pass EDC exam, it's a big dream, not easy. You must really take it seriously. You really must take it seriously. We explained this. We said we need to strengthen the teeth in the first few visits. In the first few visits, guys, if you remember this. Am I right? Easy concept is not hard at all. It's not hard concept at all. It's easy concept right now. What happiness is just a very easy and simple concept. Now, this is 2 week. And then you discuss the patient, the importance of placing crown. So anyway, you're gonna okay, guys, when you place crown, let's say metal crown, any crown, metal crown. We can do provisional crown. Am I right? You prepare for the crown and then do provisional crown. Am I right, guys? Until things settle down, and then you can, like, for any reason, you can do provisional crown, right? If it's indicated. True? Now provisional crown is indicated because the tooth is too weak. You really scored the outfit. You really scared the tooth will be broken. So he said, I cannot provide the final crown now, but what I can do right now is provisional crown. Why? Why are you going to put the provisional crown? What is the reason behind the provisional crown, guys? What is the reason? What is the reason that you're going to place provisional crown? If someone asks this question, I can move to the next. Thank you, Dr. Rana. To protect tooth fracture from fracture. Thank you, Dr. Indra. Fracture of the crown. Very good. So this is now the reason. So now what I'm going to do is I'm going to provision crown because I need to protect the tooth. Imagine you did in the first visit, you actually has decided to do pulp extirpation. And then you let the patient go home. What can happen to the tooth, this weak tooth? What can happen in the first visit? Tooth is too weak. What can happen? What may happen if you decide to do pulp extirpation and ask the patient go home? Thank you, Dr. Rana. It will fracture, it will breakage. That's why what can happen in the first visit, what we will do is in the first visit, right? What we're going to do is we're going to do, right? Clean the tooth first, clean it all, build up the crown part, the missing part, build it up with any material like GIC, for example, for now. And then you what you can do right now is just do pulp extirpation while everything nice and cleaned, and you have done a little bit of strength into the tooth. And then you can do today or next visit, up to you, as long as you build up the broken walls, which most probably that's a buccal wall. Okay? Then you're going to prepare the crown either this visit or next visit. And then seal the provisional crown with zinc cyanogenol. It's gonna stay in place nicely. It's gonna stay until you finish the RCT. It will not go anywhere. Right? Temporary seal it. Even sometimes you can temporary seal it with GIC. Seal it with GIC. After you prepare the tooth, put the provisional crown top of it, and then finish. Now you're going home to sleep. You will sleep now. You go home to sleep as a dentist. Why? Because you already protected the tooth. Even if the patient break it, in your note has mentioned, you protected with provisional crown. You did your job. You have done everything correct. What if you don't do this during the early root canal treatment visit? What if you're going to do and then the tooth broke? You're gonna cry a lot, right? I hope now, guys, this is clear to every one of you. So now, guys, when you do provisional crown, are you going to do it at the end, or are you going to do it like after RCT, not during the visits, or during the early root canal treatment visit? No, Dr. Fatima, no. Yes, Dr. Boy, you can do this, but you're already gonna do crown, right? So take the advantage. You gotta do crown, prepare it. Take it out of occlusion, then prepare it. Yes, after RCT. Yes, you're going to place. Yes, you're going to place the final crown after RCT, because you don't decide to do the proper crown in the beginning because you don't want to make a hole in it. But guys, you get the idea. If you are a dentist, which one you gonna do right now? So you are a dentist. If you have this patient in your clinic, what you going to do? You will be happy, right? You will be happy to do provisional crown right now, so you can go home and sleep because you protect the tooth. Provisional crown in the clinic. In the clinic, it's just only easy procedure. We get the provisional crown material, put it inside the putty, put in the tooth. That's it, done. In the clinic, it takes only 5 minutes. Provisional crown even much easier than restoration, guys. Much quicker, much easier than restoration. Provisional crown, guys. You guys can search for material called Pro-Temp. Pro-Temp. Pro like Pro, Pro, Temp like temporary. Go and search for this materials, guys. I mean provisional crown, daughter, as I mentioned, it was mentioned, yes. I will do metal ring and temple double shorting crown. Yeah, you can do. But you have now you have decided to do provisional crown. What is the best time then? If you decide to give provisional crown, what is the best time? Let's say your plan is to provide provisional crown to protect the tooth. So after RST means completion of RST, doctor. So now the question is, you discuss with the patient the importance of placing a crown. Means final crown. That's mean final. Final restoration. 2746 after RCT, you said, okay, after we do the RCT, we will provide you with the final crown. When should the provisional crown be placed? The provisional crown. Now you're gonna place provisional crown. When should be? It should be during, or it should be immediately after. Immediately after, the tooth may break in between. Okay. Okay, guys. I believe this book was actually great mock. You done very good. I was very happy with this book, guys. Exam is soon, and it's a big dream. If you really attend the session, I'm happy to attend my sessions. If you really take notes, I'm happy. But if you don't revise the notes, I will not be happy. But if you revise the notes, I'll be very, very happy, guys. What do you think about the mock, guys, so far? Then, if there is a was question from PFM, Metazaconia, wherever, crown, then we will place it. Yeah, place it immediately after the treatment. Remove the provisional crown, put the crown. Yeah, correct answer A, alpha. I answered this, Dr. Siash. Can we have another mock, please? Okay, I can do another mock, but then the other mock will be actually for 50 people only, as I mentioned in our group, in our Facebook group. And I will check who's guys put the names there and will only choose. That's okay, Dr. Lev. No problem, Dr. Raza. That's okay, Dr. Lev. It's no problem. Dr. Ashika, I will explain this later on because it does need a little bit of explanation. I already posted one question in our page, Facebook page, which is gingival hyperplasia. In this case, we subtract when there is gingival hyperplasia. No problem, Dr. Shiva. Dr. Teresa, please include everyone. You already included Dr. Teresa because you've been the highest champion has scored in the previous mock. So you already included because this one will be hard. I don't want to disappoint anyone. It really will be hard, really mock, not be easy mock. So only people they really scored high and they are confident that they can score high, they can attend that mock. Which one, Dr. Sarah? Why, Doctor? Which one? Already interested? Okay, Dr. Sabika, no, very good. Dr. Managed to score 80. Dr. Simran, you perfect. Managed to score 80% this time. Hopefully will be among us, the top 10. Yes, yes. And you have, I think because you scored 80%, you have the right to be one of the 50 candidates that go and take the next mock, which is the most challenging mock. Dr. Neha, provisional crown is immediately, and the final crown is yes, yes. Provisional crown should be in the first visit or second visit, not after the completion of root treatment to protect the tooth. Yes, Dr. Neha. Thank you, Dr. Fatima, Dr. Jailan. Doctor, what is the significance of dull pain? Yeah, dull pain means there is infection inside the necrotic pulp. It comes because of the bacteria gases. When I'm confused between two options, I always choose wrong answers. Dr. Amolia, I need to get your mom to pray for you, Dr. Amolia. I mean everyone else. It depends. If they are actually confident, that's okay because they don't disappoint anyone, Dr. Teresa. They know about themselves better than any one of us because the exam will be really hard. Not hard, it will be like ADC exam, like it is has more even complex tricks in it. Like some questions here. Why only 50 candidates? Dr. Sarah, that's what I'm saying because I don't disappoint anyone. There are some candidates actually they haven't started the preparation right way. So to come take the mock and then score only 10%, they will cry and they will not do EDC exam. I don't want the candidate to get these feelings, right? I only want the candidate that are very confident at this stage. They really study hard. They really attend the session to score high. Okay, do you get my point? Dua Lipa Mudon, yes, yes, Sabika. Do you hate Dua Lipa? No problem, Dr. Kanik at all. We always need more and harder question, doctor. Yes, yes, Dr. Shank, I'm happy to do this, but still, I see candidates after the coding pass exam, they text me personally and they say, Doctor, I'm very disappointed. I feel like I don't want to study. However, if you see the questions, easy to answer. So again, I keep it as an option. I said, if you're really confident that you can answer hard question at this stage, leave your name. If you're not confident, don't leave your name. That's it. Dr. Bido, will we place the permanent crown immediately after RCT? Yes, why not? We are confident about doing. The provisional crown was mainly to protect the tooth without make a hole in it, because if you place the final crown in the first visit, you may need to do a hole in it, right? So we don't want to make a hole, don't make a hole. No, don't worry about healing. You are perfect dentist. Why was reading? You know that's your job gonna be done perfectly. You did everything good. When you use 50-50. When you use 50-50, when there is an infection, right? When there is an infection, and then there will be a little bit, I would say, tooth not tender, but it could be a little bit of inflammation, but not tenderness. So in this case, you can use 50-50. Dr. Enda, 84, okay, will be involved in this, will be included then. What was the bottom level? I think it was 65. Dr. Bido, Dr. Abdulkader, Dr. Bido, please arrange another mock shortly. You are great. Thank you very much, Dr. Abdulkader. You are great too. Thank you very much, Dr. Abdulkader. You're really great. I score 80 and register for the mock. So you are allowed now for the next mock as well. Dr. Mirza, Dr. Raza, Raza. I'm interested in when the next mock. No problem, Dr. Samendra, as long as you not feel, as long as you're ready for it. You're ready for really tough mock. Yes, Dr. Tez, that's what I'm going to do. Samendra, when will be the next mock? I will be announcing shortly. Doctor, I think each one should give a trial. You are, look, Dr. Jilan, if you, I'm talking about you now, if you confident that you can sit for a challenging mock, just put your name, okay? because I don't know about everyone. I know you know about yourself, right? Dr. Jaylan, I'm talking about what I see, okay? From my point of view, I have seen candidates, they go disappointed, right? When they go through a hard mock. So this is just, I would say, to everyone. If you really know that you are confident to do the mock, leave you a comment there. If not, you are busy at work, you couldn't study, go through stuff, and you are a person can get disappointed. Don't comment. Easy. Okay? Please, Dr. Jaylan. Guys, I'm clear about this point because I care about your feelings too. I care about your psychology and your feelings. The torpedo usually reduces out of occlusion, which also allows a perimeter. Yeah, that's good. If we place provisional crown, the tooth will still be in contact, so we're not slowed down. No, no, no. You can do provisional crown. Provisional crown thickness, it just maybe at this stage you can make it very thin. It should be the same amount. Like, don't worry. It's in your hand, Dr. Ashwani. It's in your hand. You can do the thickness. You can even do provisional crown after provisional crown is still out of occlusion. It's not the final crown, Dr. Ashwani. Dr. Lev, Dr. Bidu, mock was great as all your work. Thank you very much. We really appreciate it. Thank you very much, Dr. Lev. I really appreciate this. And I see really you're progressing a lot. And I'm very proud of you. That's okay, Dr. Raza. It's not stupid mistakes. There is no mistakes, stupid mistakes. All our mistakes, I would say, it's good to learn out of it. So without these mistakes, we never learn. And do mistakes now before you go into the exam. Because finally, we don't want to repeat the mistakes in exam. We can do it now, but not in exam. Dr. Suyash, I already posted in our Facebook group. So please ensure on our Facebook group. So ensure please you comment there. Say I will not cry, need the disappointment to push us forward. I'm very happy, Dr. Shashank, to hear this. If you are this personality, definitely on the next mock. I'm very happy. Very clinical, Dr. Pooja. Yes, all my mocks, all of them very clinical. Dr. Kainet, I will be announcing soon. Dr. Bidu, in periodontitis, if bone loss is more than 50%, it's stage 4. Shashank, Dr. Shashank, okay. Thank you, Dr. Bidu. Need more sessions and mocks. Yes, and we are missing your cakes a lot. Next stage will be full of cakes. The main stage, guys, I have my own strategy. Main stage, I keep it for you mostly, right? With the study materials, we'll give it to you. With the plans, I give it to you. With the notes, we give it to you until you get your own way on the things. And then the next stage, you already collected as much as you can for information now. You studied lots. Next stage, I will be very specific in some points, and there's a cakes on it. And then you will find whatever you have studied going to help you as a revision form by my cakes. Wow, Dr. Huma, I scored 84% as well. Yes, you will be in this mock, you will be next mock as well. Wow, you're doing great, guys. Dr. Shashank, you will be then. But please, guys, comment there, please. Comment. No problem, Dr. Lubus at all. Thank you so much. Thanks so much, Dr. Lubus. Thank you, Dr. Bidu. Amazing session. Thank you, Dr. Shashank, very much. No problem, Dr. Naya. I will do this. Thank Dr. Boy, that is great. And thank you very much, guys. That was great session. I'm very proud of every one of you. So see you then, guys, next time. Thank you very much, you guys. Have a great night, guys. Thank you very much, you guys. Bye bye. Bye. Thank you, guys. Have a great night, guys. Every one of you. Thank you very much, you guys. Bye bye. Guys, I will be letting you about the study materials next. Maybe once we decide for the mock date, make time. So definitely, guys, I will let you know. Dr. Kanika, the way you explain each concept is. Thank you very much, Dr. Kanika. You are amazing, Dr. Kanika. Thanks very much. Okay, guys. Thank you very much, you guys. I believe so, Dr. Moyes. I believe so. But you see, you can comment, please, in the post there. Okay.